and welcome you all, a warm welcome. So after the heavy lunch, all of you will enjoy the sessions also, hopefully. So today we have various types of sessions kept, and it is on lung cancer. And mainly if you see the theme, which will help you to update your knowledge, and hopefully after these sessions and after this workshop, you will surely feel satisfied that you have gained lots of new things which are happening around you. So today my session is on novel approaches, updates and perspective for lung cancer nursing. So in that, what are the novel? Novel means new, right? So what are the new things happening around us regarding the lung cancer? All of you know, because historically the prognosis of the individual diagnosis with lung cancer has been bleak. They say once the lung cancer's prognosis is not that good because the progression is very fast. And there are various types of lung cancer which is likely crudely classified as, one is small cell lung cancer and the other is non-small cell lung cancer. Actually, I think most of you are aware of various types of lung cancer, so we should have a interactive session, okay? So in what we say is NSCLC. What are the other subtypes? Histopathologically, if we see, adenocarcinoma, squamous carcinoma are common, and there is also one type, it is large cell carcinoma. So depending on the type of cancer, their histology, we have the treatment, okay? So for each subdivision, the treatment is different. Yes or no? Yes. So we have seen various types of lung cancer. Now we will see, can you just answer me what are the main treatment modalities for any of the cancer? Yes, surgery, radiation and chemotherapy. Now we have added upon immunotherapy, targeted therapy, and in the radiation therapy there is a stereotactic ablation therapy and so on. So we will first see what are the new things happening regarding the diagnosis and staging. All of you know that staging is done with the TNM classification? Yes. So here also it was the classification and staging was done through the TNM classification. But recently, the International Association for the Study of Lung Cancer, they have given 8th edition of lung cancer where they have just stages of the cancer, they have just grouped together so that the treatment can be given. It is important to accurately stage the patient with lung cancer as this contributes to the treatment option and the prognosis should be better. When you are doing the staging, the PET-CT, it's playing very important role. PET-CT and EBUS. I'll say the full form. What is PET-CT? Positron emission tomography with computed tomography. It helps in the staging of the patient. Also, endobronchial ultrasound that you, in short form, you call as a EBUS. That helps for the mediastinal lymph node identification for the sampling accurately the stage. So thus, these are the newer thing which has come in the lung cancer for the staging. Now we will see about the treatment. First we will see the thoracic surgery. Thoracic surgery, what was the age-old method? Open surgery, right? Open thoracic lobectomy or this thing. But now, early stage lung cancer who are deemed fit enough for surgery, they can also go under surgery, that is video-assisted thoracotomy. Earlier it was very difficult. If suppose patient has got comorbidities, to do the open thoracotomy was really challenging. But nowadays, because of the VATS, you can do for the patient who have got a comorbidities also. So perioperative mortality and long-term survival following VATS lobectomy has been shown to be better than the surgery. So in this, you see the use of lung sparing surgery has also stepped forward. So many of the patients, they have got a lung sparing surgery. A systemic review and meta-analysis found 5-year survival following VATS lobectomy for early stage cancer to be 80% than the 65% with the open lobectomy. Okay, so mortality is also reduced. Then we will, after surgery, we'll see radiation therapy. In radiotherapy, what is new? Stereotactic ablative radiation therapy. What is the use and what is the advantage of this SABR? First of all, you can give it to the high precision size, that 1 to 2 millimeter of the tumor also you can target with small lesions less than 1 centimeter, and it is a 3D. So what happens? Lungs move, na? When you inspire, you exhale, what happens? There is a movement of lung. So during the inhalation and exhalation also, you can give this therapy. Usually what happens in our earlier conventional radiation therapy, when there is a movement of any organ, it is very difficult to target the organ. But here in this type of, you have this advantage. Now, you have also, if you see, compared to the conventional therapy, the survival rate is better. There is also one more option is your radio frequency ablation. Which is the cancer in which we give radio frequency ablation? Liver, very good. So it is used in lung cancer also nowadays. It is used for early stage for peripherally based tumors. Okay, what they exactly do in that? Under the CT guidance, an expandable needle which contains multiple electrodes is put and inserted and it percutaneously, and there is a current is passed through the electrodes, causing the thermal destruction of cells and the coagulation of the cells. Coagulation and necrosis occur. So this is the radio frequency ablation. Instead of radio frequency, you can alternately use microwave ablation also. We have seen surgery, we have seen radiation therapy, and what's new in the systemic therapy. What are the different systemic therapy you are giving? Chemotherapy, yes. Okay, in chemotherapy, various drugs are used. You are master in that, all of you. Vinca, alkaloids, doxorubicin, etc. But nowadays you get oral agents like geftinib, which is a immunotherapy. You have got a targeted therapy. All these are the new therapies which are existing. So new agents such as protein kinase inhibitor, etc. are available. Okay. Mechanism of, I think, immunotherapies, my next speakers are taking, so I'm not going in detail. Just briefly telling you what are the different technologies and different modalities have come. Now we have seen about the different treatments and different modalities. What about nursing? Is the nursing improving or not? Yes, you are saying yes, but what are the different models they are using all over the world? First of all, common physical complaints with lung cancer. What are the common physical complaints patient present with? Can anybody enlist the complaints? Dyspnea, fatigue, pain, anorexia, cough, insomnia. All these are the physical symptoms, isn't it? So one of our speakers is going to tell us about the symptom management also. But apart from the symptom management, which are physical, there are the mental symptoms or mental stress also. So patient undergoes depression, anxiety, lots of stress once she is diagnosed with the lung cancer. So the new model has emerged as the participatory evidence-based patient-focused practice. Means if you are all of us following SOPs, isn't it? So if we have to write a SOP, it should be a participatory. Participatory means all cadre of nurses along with the other specialties, you take evidence. Whatever nursing we are doing, here suppose I am giving a back massage. So back massage, age hold, we are telling that oil is better, this is better. But have you done any comparison study? Once you do any study, what happens? It gives you proof, evidence. Recently, Mr. Prabhu has presented ICU study in which he had used silicone pad for the prevention of bed sores or a decubitus ulcer. So it is a evidence-based study. So nowadays the approach is participatory, evidence-based and patient-focused. Each patient requires a different management. So the patient care, how it should be? Tailor-made. What I need may not be the other person's need will be the same. Everyone's health is different and need is different. So your patient care should be a patient focus. So, and that was one of the nursing aspect. Now, second aspect is an integrated nursing care approach. What is integrated nursing care approach? The integrated nursing care group is composed of therapists, various therapies. Your clinical psychologist, your physiotherapist, nutritionists, doctors, oncologists, radiologists, nurses. So they will have a team which will plan a care plan for the patient. So it is not an individual nurse who's planning the care plan for the patient. So this is the integrated nursing care approach. An integrated nursing care approach for lung cancer patient can effectively relieve the patient's negative feeling, improve their self-management ability, and help to reduce the burden of family care and improve the patient satisfaction for the nursing whatever activities we are doing for the patient. So this was about the nursing care. Then supportive and palliative care, I think one more speaker is there who will be talking about the supportive and palliative care. In supportive and palliative care, integrating early enhanced supportive care means it is not that when patient is declared whatever DNR you are planning for palliative care. You are starting the patient supportive care right from the beginning of the diagnosis. So there is strong evidence that early palliative care improves the quality of life, reduces the depression, and improves the satisfaction with the care. One more thing is that in Western countries, they have a complementary and alternative therapy which is coming up, which is also called as the integrated therapy. All of you must have heard about Ayush, Ayurveda, Unani, homeopathy, etc. Yes, in our curriculum, Ayush was there, na preventive mein pada hoga. Yes or no? So same way, here in Western world, what they are doing, they are gathering the evidence of various therapies, homeopathy, Ayurveda, like our curcumin, what we are using, haldi. Okay, that is proved as an antiseptic. But we are using age-old, but we never had a proof with us that it is really playing an antiseptic role. So they did research and it was found useful. Same way when we talk about ginger, in a patient who are having chemotherapy, side effect, nausea, vomiting. So it is useful in the patient who are having nausea, vomiting. Ginger is playing excellent role. So how it is proved? It is done with the research, your evidence base. So our nursing is day by day, we have to make strong with the evidences and a integrative approach. So thank you, all of you will enjoy the next sessions also and welcome you again for this conference.